Okay, I see us. So, gonna send a blast to the Luma.
I like live better.
I like live better as
It's more
well.
it's more real.
It is more real. Seeing people joining. Yeah, we were gonna, and then we have the chat so people can chime in. It's gonna be really fun. Okay, let's see. I think it'll take a little time for some people to get that blast and join. You changed your devices, Michael?
Did it
I don't
change?
know. I don't know. I got
I
a
think I
weird
just
I got a weird
muted for a
warning.
second.
Oh, okay.
I'll check in a second.
Yeah, it seems good. But yeah, we'll
Yeah, I think
start
so too.
right at 4.
I like the UX of all these systems. They're like, it'd be a great time to do all these tooltips. It's when
I know.
someone's on a live broadcast.
Yeah, when you're in a live broadcast, it's like, please update. Now is the time. Like it's
Yeah,
every
that's
time you go
that's.
into a Zoom.
Hmm. Yeah, now that we have more B2B kind of corporate partners, it's a lot of it's all the like updating your WebEx and your Microsoft Teams.
Yeah. Let's see. I'm gonna put a post on LinkedIn as well. Why not?
Look at you.
Why not add more? Okay, post. We are going live right now. Join us. Okay. 2 more minutes.
Just imagine all the dedicated San Francisco and California viewers
Yeah, waking up first thing in the
out there.
morning, they're like, Nina's notes, live, first live podcast. I need to be there.
I mean, actually, I'm a bit more sharp in the morning, so yeah, an espresso and watching this would actually probably be better than watching it at the end of the day.
That's true. It would be a lot more fun. Okay, Mike, do you think you're ready? It's
It's now or
nearly
never.
time. Okay? It's now or never. So, let's get into it. Hey, friends. Welcome to the first live recording of the Nina's Notes podcast. And today we're talking about something that affects every single one of us. What if healthcare could see around corners? What if instead of waiting until you're sick to treat you, your doctor or an AI system could predict what's coming and help you avoid it entirely? So, to discuss this, today my guest is Michael Geer. Michael is the co founder of Humanity. And Humanity is a company building tools to measure and reverse biological aging. They focus mostly on their human age API, which allows partners to use their API to provide biological age to their customers based on data they've already collected from their customers. They partner with some of the big blood testing companies, and the blood testing companies will then use the Humanity model to give those customers new information about their biological age. Before Humanity, Michael helped start Badoo, which is now part of the Bumble Group, and he helped grow that dating platform to over 300 million users before turning his focus from dating to something equally important, longevity and health prediction. Michael was also my very first podcast guest on the Nina's Notes podcast, which was 2 years ago. Mike, how does the time fly? It was episode 80. I can't believe it. I will drop the link in the show notes so that you guys can check out that episode if you want to see where Michael was 2 years ago and what Humanity was doing. So welcome back to the podcast.
Thank you. Yeah, it's an honor to be here. And imagine we didn't think that people wanted to see our beautiful faces, so we didn't even do video for the first one.
I know.
Crazy. I mean, look at us. Look at us, Nina. Come on.
I mean, look, with the post, with the matching post. It's true. I mean, we recorded on the same microphone when we recorded that episode, which is crazy. We were sitting in your office and we're just like, let's do a podcast. And the Nina's Notes podcast was born. So I really appreciate you taking that leap of faith with me, doing the first podcast and now doing the first live, because this is also an experiment. Yeah. So we're also seeing how this goes. That's an honor. But it's super fun and I know we're going to have a good conversation. So let's get into it. You built Humanity to calculate our biological age. And this idea is that we all can be healthier. We could be healthier than our current chronological age, and then we can see the way we're aging. And essentially, you're making predictions about someone's current health and future health based on their behavior, their exercise, their nutrition. But a lot of the healthcare system today is really, it's like acute care. You know, you get an infection, you go to the doctor, you get antibiotics, or you break a limb, and they just, they can stitch you back up and get you out of there. But when you come to the doctor with like a problem and you need to run a bunch of tests, and then you get over to this specialist and that specialist, and you see how fragmented and siloed the healthcare system really is. I'm wondering if when you started Humanity, was it because you just really saw that the health system was falling short and it was falling into those silos? I'm curious if you have really a personal story there.
Yeah. I mean, one of the things that made both me and Pete, my co-founder Pete Ward, start Humanity was basically I had a relative find out really late stage about cancer. So basically fell through the cracks, right? Was generally getting health checks and just wasn't identified early enough, identified really late. And Pete's dad had a stroke out of the blue when he was about 61, so ostensibly healthy. Yeah, exactly. And so I think we both had people, and unfortunately many people watching this, or maybe everybody watching this, will have had someone that kind of fell through the cracks like that. And so that was one of the big impetuses. I think the other one was like, when we asked ourselves, like, am I healthy? There was this funny thing when you would like go around and like try to get an answer of that, is like no one had a specific answer. It was like, okay, well, cholesterol is bad, you should do that. And if you're, and nowadays it's like, if your HRV is high, that's good. And it's all these floating things that are not calculated, in a connected way. And so it wasn't until we basically came across a lot of people that spent a very kind amount of time with us, a lot of experts in the field. One of them was Kristen Fortney, who has a company called BioAge, who's amazing, and the company's amazing. But she was the one that finally turned me onto this idea that you could look at longitudinal data sets. So these, they've been monitoring the same people for the last 20 years. So they have measurements on them in the past, and then they actually have their health events. And so I just got a warning from okay. I got a warning that I couldn't get the video. And so, awesome. So is basically that you could look at these data sets and you can make predictions from them. You can make predictive models from it. And it was at that moment it was finally like, oh, because we were product people. Pete did one of the first social networks, as you mentioned. I did Badoo, big dating site, and so we were product people. And if you can't measure something, you can't hope to improve it. You just head in a weird zigzag. You don't know which direction you're going. And so it was finally when we saw that we could have, oh, that's how you measure health. You can actually predict future health by looking at data sets that actually have people's measurements in the past and actually have their futures. Uh, and I think it was those moments of each of those moments, like first, like, hey, we need to be less helpless so people don't fall through the cracks. And then meeting people like Kristen and others that kind of taught us, hey, there's actually, and this is before, it was before Transformers, which is something that we'll touch on later. Um, but people already were doing a lot of machine learning, obviously, and a lot of bioinformatics. Uh, and so that was like, hey, we can actually predict the future, and it's only going to get better. So now we can go out there and give people that information.
So when were you really convinced of that moment? You were talking to Kristen, you were meeting with all these people, you found out about the biobank. And when were you convinced that if we're going to switch the healthcare system to prevention, it's going to be a prediction thing rather than fixing the system itself, and actually getting those silos to talk to each other? Because I think I've sat in that camp for a really long time where I'm like, okay, we just need to have a more holistic approach to healthcare. But you sit more on the prediction side. So when did you really have that like light bulb moment?
I mean, rightly or wrongly, we were quote. I was quite self-confident from the beginning that like, hey, if you're able to measure something more accurately, we will. I guess I had confidence in all of us as people. Like we will, if we know how healthy we are and we have that feedback loop, we will follow it in the right direction because we do want to be healthier, and that we've been taught over and over again with, we had, a couple 100,000 users on our app, and every single time that you actually see real data and you actually talk with people, like everybody cares about their health. It's just a matter of, how much effort and how much feedback loop that they're getting to reinforce their behaviors. And so I think it was those kind of moments. When did it really start to, I mean, you gotta, and we'll talk about it a bit, like you really gotta give like ChatGPT and OpenAI team, and obviously a lot of other people have done LLMs and have contributed, but that was kind of the moment where it was like, oh, no, we were right all along. You can create magic from this, which is basically you can create magic from prediction. And as prediction, one of the things, I won't go too deep down the rabbit hole because I know we want to cover some other stuff, but like one of the things is that when you have models, and some people that like follow ChatGPT and models will know this word, like you have emergent kind of qualities that come out of it. An example would be like ChatGPT. Some people like, oh, it's shit at math, but no, can we swear on this?
Yeah, but we're live. It's fine.
Yeah, who's gonna stop us? Like there's some FCC sitting. And so you have these emergent qualities, and so it basically, as there's things that don't exist in a functional way until the prediction power gets above a certain level.
Yeah.
And so it really seems to us, it seems binary, like prediction isn't able to do that, and then prediction magically is now able to do that. And so that was, as we've seen all the models get more and more high powered, and the prediction power going higher and higher, that's been the moment where it's like, oh, we are actually live in a world where we can predict anything, and that world is coming much quicker than we ever thought. And so this world will exist, and it's going to exist, this decade kind of thing.
So when we're talking about this, so the listeners and my subscribers understand, it's like, okay, the way we're talking about large language models, Mike thinks about large biological models. And I really want to hear about what data do you need in these large biological models? Is it just everything about the human body? Because I, as a non computer scientist, I can understand what a large language model is trained on because I'm like, it is trained
Mm-hmm.
on letters and words and sentences, paragraphs. But when it comes to our biology, we have a lot more complexity there. So, do you want to dive into? Okay, we have DNA, but I'd rather have you
Three
explain it
billion
because
letters, yeah.
yeah, exactly. There still
But
is
there's
a
four of
code
them.
there.
They're just
Yeah,
repeated.
yeah.
Yeah. Yeah. So I think I'll try to put this in kind of a building up format. So when you have these large language models, the innovation that came with transformers, which is the thing that you run all the data through to come up with a large language model, it's a software kind of mechanism. Um, Basically, the innovation there, and hence the first paper that is kind of like credited with, and for good reason because they basically invented it all in one paper, was credited with transformer invention was attention is all you need. That was the paper name. It's kind of a, as Andre Karpathy says, it's kind of cool that it was a meme. It was a memeable name, which you usually
Yeah.
don't. You read a lot of science papers, you don't usually get that. So it's
No,
kind of cool
lots of
that one of the
scientists
cooler papers is.
try, but they fail miserably.
Yeah. And who's to say that they actually knew that this was going to be such a cool name? But like, attention is all you need is a kind of a cool. And so basically, I'll connect that up to what we've done so far with humanity, is basically the main thing without diving into the weeds too much is, hey, you can't understand the value, the predictive power of one thing unless you look at many things at the same time and understand the prediction power between all of them. And then only as a set, you can understand the predictive power of the thing that you were interested in. And so that's the attention mechanism is kind of saying it like it looks all around it. It looks at the whole sentence, say, just as an example, and only then does it start to decide the weight of the word the, or the weight of the word animal um, in that sentence. And so when you look at what we've done with the humanity model so far, so not a large biological model that I'm talking about right now, but just is one of our innovations was we said, hey, this kind of old school, like, hey, if your cholesterol's high or it's bad, and if cholesterol's low, it's good. It just doesn't make sense. When you look at the data, that's not what it does, right? Uh, and so if you look at just cholesterol versus future health, maybe you would see that relationship, but you need to look at cholesterol next to white blood cell count, next to name your other 10 markers. Then only when you look at the set, then you can appreciate how important cholesterol is in that set, and you can understand the whole predictive power and what that whole set means when you look at the values. um, and so that was the innovation that basically, to put in a very simple way, like context matters, and our oversimplification in the health space, especially, of saying this is good, this is bad,
Yeah,
is just it's factually incorrect.
yeah.
And so I think that's one of the key learnings with large language models is, hey, if you run enough data through, then you'll be able to really understand how important that one word is in that context, and you'll be able to understand the meaning. People would use the word meaning of it, but only in context. And so the kind of looking forward, without rambling too much, but looking forward, what's so exciting, and back to your question, what's so exciting about biological data as opposed to just words, is that, to keep on the same theme, the context of words is missing two very important things. It's missing two very, very important contexts. One is time. So, like, if you have a sentence, none of those words are related with time. Like, they're not in a time sequence. They're just in a random order of words. But they're not related to time. The other is location. The word "the" is not related to a location, or even if it's the name of a location, it's not. The data is not related to a location. Um, and so when we look at biological data, those two contextual things are pretty much everywhere. It's like all biological data has a timestamp because you measured it at a certain time, right? Or you took the pill at a certain time, or you did the surgery on a certain day, and you know the location being the person. So the surgery was done on Mike, or the pill was taken by Nina, right?
Mm-hmm.
Um, and so what we've seen magically happen with large language models is the innovation was attention. So we're going to look at all the context when we decide how important something is. And then, but we don't have these, so context matters. And that was the innovation. And we've already seen the magic of large language models. Imagine what happens when we add in two of the most important contextual things that we know in the universe. One is when did it happen and where did it happen, right? So
Mm-hmm. So when it comes to like applying these large biological models into making predictions, so you're taking in these two other elements, you're taking in information about blood test results or DNA. That's where I got confused because I was like, okay, there's so much we can measure.
mm,
What are, maybe I know
that's a good point.
what is humanity measure, like not humanity, but humanity, the app. What is humanity
We're all members.
measuring, and what else should we be adding in? Like, is it
Yeah.
just the most we can do, the better?
I mean, on the last part, sure, but usually you're needing to decide. So it's important to make a differentiation. Yeah, it's a great question. And this isn't to throw shade, or at least not too much shade at some. There's definitely this idea that we need to map out all the billions of interactions that happen in the human cell, and until we understand every single one of those interactions, or as we understand all of those billions of interactions, we will be able to predict everything.
Mm-hmm.
And the reality is actually much easier than that. Um, Especially if you're talking about a human who wants to know how to be healthier. Uh, the reality is that you basically just need, okay, like what is the current state of the person, which you can get with blood tests, or you can get with, basically biological age is a great
Mm-hmm.
indicator. And so we use blood test results, even simple ones, for our API. We can take in movement patterns, so just your movement pattern over a couple weeks, your heart rate pattern over a couple weeks, and you only need like one of those. You don't need all of them at the same time. As you get more data, you get higher prediction. Um, but basically, that level, if you want to think of it, is enough. Like a biological age, okay, they did this, so they had that surgery, or they did, or they took that pill, they ran those 20 minutes. That kind of stuff is enough to actually get to the level of highly predictive and guidance level that can actually keep us healthier for longer. Um, when The analogy I like to use is because I was an engineer, I wanted to be an astronaut, so I did aerospace in school, and because I think I researched for 30 seconds that the two professions of astronauts was like Air Force pilot and aerospace. But so I did a bunch of engineering classes, and if you think about it, like we didn't really know much about quantum physics, or it definitely wasn't
Mm-hmm.
prevalent in major kind of physics learning until like mid last century. People were talking about it before that. It was like a cool thing, but it wasn't like part of it wasn't applied in any real sense of the word. But we built a ton of skyscrapers. We built a ton of structures, right? And you know what's holding up those skyscrapers? Quantum physics. We didn't know
I was
anything
going to
about
say
quantum
hope.
physics. Yes. Belief.
Belief.
Maybe in a way. Who knows? But we knew particle dynamics, right? We knew friction. We knew statics. We knew,
Mm-hmm.
we knew the basic physics, particle dynamics, and that was enough. We didn't need to know really what was going on. We just had a framework that basically could tell us, hey, how do we need to lead those two pillars together? How many rivets do we need to put into that? And how much weight can that steel take? Like all these things are just particle dynamics. And so this idea that we now need to go in and like learn all the billions of interactions of a cell, it's a bit of a hobby project if I was to be a little bit more disparaging, because it sounds cool, but it's not getting us fast to the direction we want to get to. Is basically be able to monitor and predict people's future health. So I'll leave it
I
there.
also think the more we learn about at least like cellular signaling pathways, which you're mentioning here, we just discover more and more and more complexity. We think we have that pathway figured out,
Yeah.
and then it turns out that there's so many more proteins involved or so many more messenger molecules that need to be attracted, and it's almost like this like Pandora's box each time, and
Yeah.
so I like that you're viewing it as if we have an overall understanding of how these things work, that's even enough for us to start making
Yeah.
predictions.
Yeah. And when you get up to a higher level of pathways, I mean, if you talk to a longevity person for hours, and even a like highly scientific longevity person, you're probably only going to hear about 4 or 5 pathways, right?
Yeah.
Like
Yeah.
you're going to hear about mTOR, you're going to hear about like name a few more. Like you're not going to go deep. And why is that? Because they think those higher level pathways are the important ones, and
Yeah.
they're not that interested in spending too much time talking about, even if they have the knowledge of the things that are happening underneath. So I think that's, if we look at if we applied a transformer to the science space, the attention weighting of those billions of interactions would be very low. Sorry, that's the last disparaging thing. Just thought I'd use a
What
transformer analogy.
what bits of healthcare don't fit into this prediction framework? So we're talking obviously just about a biological model of the different readings in our body, but what about other more of the healthcare experience as a whole? So interacting with your
Mm-hmm.
doctor, the art of medicine, and doctors making decisions as well. Does that fit
Mm-hmm.
in, or does that counteract the prediction framework?
Yeah, I mean, I'll go straight with the more controversial side of that. No, yeah, doctors won't be making many decisions in the near future. I think that's, um, I think that's most, even most, I think doctors that are kind of like on the cutting edge are pretty sure of that too.
What's going to replace it?
But
Because sorry to
yeah,
completely cut you off
yeah,
and
yeah,
derail this, but
no,
I
okay.
think I saw a headline today or yesterday that ChatGPT is no longer going to be able to give medical or legal advice. I don't know who made this
Mhm.
decision. I don't know where I saw this headline, but what do you think is going to happen there? Because obviously
Mhm.
my mind goes to the doctors are being replaced by large language models,
Mhm.
and first off, what do you think happened with ChatGPT not being able to give health advice anymore? Like, how is that going to affect doctors today? And then,
Yeah.
and then, do you mean that doctors are not going to be making decisions anymore because it would almost be unethical to not leverage a large biological model or a large language model?
I think you put it much better than I could have ever. Yeah,
Okay,
the,
well,
the
then I
ethics,
answered
the
my own
ethics of
question.
it. But without going too far down another rail that I'm definitely a big proponent of is decentralization. Um, I think I think whenever you see any of these systems, social networks were the first ones that most people saw this happen. When you have such a concentrated decision making, whether it be Jack Dorsey and now Elon with Twitter, uh, all these kind of things, you see these things happen every time, and so that's why decentralization is better. The beauty of AI, and if anybody spends any time on Hugging Face, and if you haven't, go check it out, is you have all these models just for download. Even OpenAI uh, eventually kind of had to put an open model up on Hugging Face, so you can just download OpenAI model from 3 months ago on Hugging Face now, and basically download it for free. It's on your computer. You don't have to run through their API or anything. And so I think that's what OpenAI decides to do or not is actually not that. They've done a lot of great stuff for the space, but it's not really that important. Like we now know the possibilities and how many lives can be saved with this technology. So it's not really one person's decision anymore. Um, I think, and just to parlay that into what we're doing with humanity is and do I have that book anywhere? I should have put it close. Um, One of my heroes in life is Tim Berners-Lee, and he's the guy who invented the World Wide Web. It actually invented what we know as the internet. He didn't invent the internet. The internet was a bunch of data transfer between some universities and some institutions, but everybody would not have had a chance to actually interact with the internet, and the internet would not be what it is today if it wasn't for Tim Berners-Lee kind of tying all these things together, where you would type in a website, go there, click on a link, go to another website. And so one of the things we're doing with humanity now is we're training. It has a nice acronym. It's called LIFE. It's Life is for everyone, because Tim said the web, this is for everyone, and so it's a homage to him. But Life is for everyone is an open model that we're just starting to train, and so that will be up on Hugging Face, and so you'll be able to download it. And so to your question of like, can these things be, controlled, or will they be stopped because someone decides to stop it? No, because these things will be available to everybody, and as it should be.
Good. So I'm glad that you're going to be putting your large biological model open source. And so what does that look like for somebody like me that's not a computer scientist? So if you have your model up there for anybody to use, what can they go do with it, and how can that also help feedback into making the model better?
Yeah. So yeah, it's early days at the moment. So yeah, definitely a call out to people that want to contribute both data that will train into it, people that want to work on it. So those are ways that people can contribute. What we'll get to fairly quickly is people will be able to will basically, just like ChatGPT has like GPT 1, 2, 3, we'll have Life 1, 2, 3, 4. We'll get to a place where people can download it from Hugging Face and probably a bunch of other places. And so the way that in the health space, to put it in kind of concrete terms, so usually what happens, you know this very well, but I'll say for like the listeners, like usually what happens is if you're a researcher or a person that wants to do something in the health space, first you need to either get your hands on a bunch of data, or raise a bunch of money and then get your hands on data, or raise a bunch of money and create data.
Yeah.
And unfortunately, we all know that way too well.
Yeah.
And you end up with having a certain amount of data. It's never enough, or never as much as you'd want. And then you try to train your model on that, and you try to make something useful for people that can make them, help them be healthier from that model. And that model is always some kind of prediction. And so what happens with a large model is you train it on a lot of disparate data. You don't think of the end results. You don't think of any end model that you're going to try to train on top of it. You just try to train it and make it learn all of the interconnected relationships and between all the different variables, the blood tests, the disease states, everything. And so then the person can come with their small data set, say that researcher that has cobbled together that small data set. And effectively what happens, and this isn't going to be science speak, but like kind of like effectively what happens conceptually is it is able to get more signal out of your small bit of data, because it's able to know what are the general patterns that are at play here, and what is being caused by that thing that I'm looking at, like this treatment for these cancer patients. So I have a small set of cancer patient data. They're all getting these different cancer treatments, and I want to know like which treatment is working better and for who, right? And so usually you get to a certain level of signal, but not enough, or you'd always want more. And so if you have this foundation model, this large biological model, it can basically tell you, hey, what's happening in these people's bodies just because those are the natural patterns, and what's happening because of that treatment. That would be the very concrete kind of use case. And the researcher or the company would then train their model in conjunction with the foundation model, with their smaller data set, and their predictive power would be much higher because of that.
So in that scenario you're talking about real data that's being collected by people and how they're responding to those cancer treatments. But something that I know that you really want to get into, and also that we're seeing more and more of, is this idea of digital twins. So creating, like the digital representation of the body or the cellular system so that you could try those cancer drugs before, actually testing it on the person and them having to go through 3 rounds of chemo because the first round of chemo didn't work. How does that actually look? What does that actually look like right now in terms of like leveraging a large biological model? Because this is very, very new to me.
So you already have models at play, the higher level models, in most places, and you know this well. Basically you do have some level of modeling that basically says, okay, cancer patient comes in with this presentation. These are our options for treatment. Here's the data of like, here's the kind of 5-year survivor level, or 6-month, year, 5-year kind of survival level if the person does this treatment, if the person, so you're basically just predicting the future based on the treatment or the combination of those treatments. Unfortunately, your prediction power is quite low, and so you do better than random. You are able to, most good places are able to give the person some guidance, and that guidance is better than not having that guidance of which treatment to do or which combination of treatments to do. But you still have very little, still quite low confidence on like that they're definitely going to make it 5 years because you combine these two things. And there's two sides of it, not to get too much in the weeds, but there's two sides of it. One is predicting the future generally, like this kind of cancer, and then those treatments, and what are those predictions of the future for each of those treatment paths. But the other side almost gets ignored a lot, which is what else is about the person, like the stuff that's not the cancer, right?
Yeah.
Like, usually you don't get too
all
much
all the
past,
healthy bits, yeah,
which will very much affect what's going to happen in that body once you give that treatment, right?
Yeah.
And that side is almost always forgotten, but then that's why I bring it up, is it's not just that you'll be able to predict this type of cancer will react this way. You'll be able to say this type of cancer in this person and list a bunch of different things that you normally have on that person. You're just not using it to make your prediction. And because the model will be more generalized, the large model will be very generalized, and then your model on top of it can stay fairly generalized, or at least we'll be able to take in all those data points and improve the prediction because of it. Where in the past, the last thing I'll say on this, just so if people are following along, it's kind of like in the past, basically, and especially another bugaboo of mine is RCTs. In the past, you would basically be able to say you can only afford to have either you can only afford to have about 5,000 patients worth of data because you had to buy it from somewhere or get it from somewhere, or you would only be able to, in your human trial for your treatment, you would only be able to afford having 5,000 people, or if you're lucky, kind of thing. You can't, as you add in variables of what those people are, so female, male, which we forgot about females till the 90s, right?
Till 1993, yeah.
Yeah.
Weren't forgotten. We were excluded intentionally. So.
Nina, remember, these are the same people that are still on stage saying gold standard, by the way.
Yes, that's true. That's true.
We forget that sometimes. These very discerning people that cut out half the population, gold standard. Yeah. And so, but back to the less disparaging. So basically, as you said, okay, male, female, okay, then you have 2,500 male, 2,500 female. And if you say, okay, age bracket even, then down to these groups that you're then down to. And so you're very quickly down to trying to model for a specific type of person on 50 people's worth of data or 5 people's worth of data. And you don't do that because it gets too noisy. And so that's the kind of thing that will now be possible when you have a large model living underneath as a foundation for those models that they're building on top.
Basically using these large models for healthy prediction is where I want to lead the conversation out, because I want to talk about longevity
Mm-hmm.
and I want to talk about biological age and how far are we from actually predicting if I'm going to walk up this hill today that it's going to impact my biological age right now, because I know this is
Mm-hmm.
what you do at Humanity. So
Mm-hmm.
is it these small little changes that you can already predict if I just like swap out my broccoli for rice for my meal today that I'm going to live like 3 years longer? What does it look like?
Yeah. Yeah, and I think it's a great question. And so right now, I'll give you a concrete example. So right now with our users, so our main focus is our API, and we want to allow everybody to give biological age to their users, but we also have an app. And so with those users, I can give you one data point. So we broke it into I think it was like 8 cohorts, and 2 of those cohorts, and I use this example because it goes back to the like nothing's good for everybody, nothing's bad for
Mm-hmm.
everybody. Uh, 2 of those cohorts, moderate exercise didn't do anything for them. It was a waste of
No.
time.
How?
And so it's just what the data said. Like, so basically for those people, if I'm remembering correctly, and again, these are big cohorts, but like, if I remember correctly, it was basically like if they actually just walked around more, so movement throughout the day,
Mm-hmm.
and if they did even like, 10 minutes of high intensity or even 5 minutes, they would get more health impact out of that. And yet, because of we are not at that point with the public health yet at the moment, but we're about to be there, is everybody is saying, hey, go out there and get, 30 minutes of moderate, right?
Mm-hmm. Yeah.
That's what, but one, for some people, and then there's all like, what are you more, what do you want to do more? And so you could end up like getting a lot of people a lot less healthy because they don't like jogging for 30 minutes.
Mm-hmm.
Uh, and it's not actually doing anything to make them healthier. And so like you're actually driving people towards worse health by giving what you think is like, hey, it can't hurt to tell them to do 30 minutes of
Mm.
moderate, right? And so that's the kind of world that we live in. But to your question, so the app is able to differentiate and then give you better suggestions. But that's still like almost univariant. It's still low level. It's not
Mm-hmm.
there. And so what we just talked about is basically these emergent these emergent abilities will come as a prediction. And this is why we're starting to spend more of our time building out this open large biological model.
Mm-hmm.
Is because we now know, looking at large language models, that we have these emergent capabilities that are not actually that far outside of our reach.
Mm-hmm.
And what would be an emergent capability that would probably show up very quickly is we would go from being able to say, hey, you should do more high intensity and less, spend less time on moderate exercise and do, spend 10 minutes doing high intensity instead.
Mm-hmm.
We can go from that very kind of like crude, coarse suggestion to basically say, hey, based on what you've done the last few weeks and based on everything we know about you, so based on what you like to do and based on everything
Mm.
we can predict will happen when you do this combination of these 10 different actions, we can tell you exactly what you will enjoy the most and what will make you
Mm.
the healthiest. And here's exactly what it is, right? And so that emergent
Yes.
quality, we don't have that capability right now with the Humanity app. But once we're
But it's
built on
coming.
top of this foundation model, you're able
Mm-hmm.
to, that will emerge and even more magical things will emerge, right?
Can we also model different interventions before trying them? So let's say maybe some of these different types of supplements, like resveratrol
Mm-hmm.
or the longevity drugs like rapamycin, or other things that are just buzzwords that, or not buzzwords, but that are rising into popularity right now, like creatine
Yeah.
and these sorts of things. Would we be able to model that and then see how that would affect me?
Yeah, easily. Yeah.
Yeah,
Yeah,
like
that would be a quick,
that's not
that
even a
would
hard
be,
one.
I mean, that would quickly emerge. I think,
Okay.
I think because it'll quickly emerge, you'll be able to say how much. A big
That would
problem with all
be
that, as you know, is like,
really good information. Yeah.
like, if you know that you're going to have to, how much will it take for this to have an effect and what other things will happen? Like, because a lot of times, as you know well, like you'll get a headline and the headline's true. Like this resveratrol, sorry, I won't pick
Yeah.
on a particular one. This
Yep.
thing reduces inflammation. That headline's true.
Yeah.
But the fact that you need to like have a bowl stacked up to this of powder
Yeah.
with it, and
Yeah.
you would you reach toxic levels way before you get the
Yeah.
benefit. Like that is actually very very common with
Yeah.
behind these headlines, right? And
Yep.
so that sort of thing is. But the reason why we don't have that, it's not because people are just like trying to avoid the truth. The reason why we don't have that is because we have such, even when we have decent size, a bunch of people taking a particular thing, there's so many confounders underneath and there's so many differences, but they're not so many, but there's enough that we can't get a good read on like who should take this and how much, right? And so that's
Yep.
another emerging quality that will actually be quite quick, is we'll be able to say, hey, for you, Nina, with everything else we know about you, you should take a gram of this twice a week, and everything that we know about its effect and everything that we know that what else you're doing, we'll know exactly the effect that it can have on you. So,
This is what the world has been waiting for, Mike. This is
yeah.
what I feel like there are so many companies out there right now that are giving somebody like an intro survey to learn about their lifestyle and their wellness, and then they give them a supplement stack. I know you and I both know tons of companies that are doing this, and
Yeah.
there's a lot of evidence that's backing it up, but it's not at this level of personalized medicine, personalized supplementation that you're going to get at with the large biological models. So this is
Yeah.
exactly what is lacking, I would say, in wellness and in healthcare.
Yeah. And I think there's a great kind of self perpetuating or virtuous cycle. Is that the word we use? There's a, so basically, like people measure some stuff. Some of us measure a bunch of stuff. Some of us don't measure much at all. Um, but what happens a lot of times is we're kind of taught not to care about measuring, because you get a measurement, say you get your blood test, which is actually really valuable data, and everybody should get their blood tested, fairly often,
Thank you for
at
the
least once.
reminder. I'm trying to
Yeah,
schedule
exactly.
mine right now,
I sent
and
Nina a message earlier.
I
It's
know
like,
Mike literally was like, "Send me
do it,
your blood
man.
test results." I'm like, I have." Because you have to fast before you have to go in for the blood test, it just creates this complication. And then it's hard to get on the schedule. And then all of a sudden they want you to do the blood test at 3 p.m. And you're like, this is impossible for me. So
It's actually a good. We can get rid of that fasting thing.
can
Like that's
we?
another thing. Yeah, because it's
Because it's
there
only
because
for
of,
it's only for glucose.
and it's there because of confounding, right? Like
Yeah.
they won't. They would then need to give you a survey of like, did you just eat before you came in? And they don't want to do that, so they're just like, everybody in the world must fast until blood tests.
Yeah.
but
And
but if you were able to discern the difference, which you easily can, by the way, like you can tell the difference between a glucose spike and a glucose, like
yeah.
if you look at the data, you can definitely tell the difference, right? And so yeah, actually, that's a good one. We should look at that one.
Okay.
Um,
Yeah. Yeah. Like jot that one
Great.
down. It's the next thing
We're
for
working with some
humanity.
big blood testing companies. Like, hey guys,
Yeah.
we'll do a model for you where you don't need to make people fast
Please,
anymore.
because this, I think
Um,
that would really improve the user experience, in my opinion, because this has been a huge problem for me. Like
oh yeah,
I was at the hospital yesterday. I could have done a blood test, but I was there at 4 p.m. and I was literally eating cashews. So I was like, I can't go down to the lab.
yeah, and
Yeah.
not to make it too serious, but like a bunch of people have conditions that they really shouldn't be fasting, and definitely not till
Yeah.
2 p.m.
Yeah.
Uh, and they're taking certain medications or whatever, and so yeah, it really puts a limit. Sorry, where were we?
Well, okay, let's get back to it. So, what are the things that you could predict really, really well right now?
So I think I'll kind of, I won't completely answer your question maybe, but I'll give you a sense of where we are, right? Is basically before the beautiful thing that happened recently in the last few years is again ChatGPT and Claude and all these kind of user facing chat interfaces to LLMs. They basically made us believe in magic. Uh, they made us, and to put it in a very, very important way, they made us to expect that we can do magical things with data. Uh, they, they made us believe again. I mean, some of us were always believers, but like they made the general population believe, right? And so if I was to, right now, the cool thing, if I was to tell you or someone on the street that has used ChatGPT or one of these, hey, we can predict this. Like if it was before ChatGPT, uh, basically there would have been some percentage of cynicism throughout, or
Yeah.
or some like either cynicism or great surprise, right? Oh my God, you can predict that.
Yeah.
The beautiful thing actually is that now our expectations have been brought up, and which is a very good thing because it will move things faster. And if I could tell you anything right now, and you would be like, "Oh, that's cool," but you wouldn't be surprised. You wouldn't be like, "Oh my God, really?" And that's the beauty of the time that we're living in right now, and that's what we need to harness, really.
So, okay. So you don't have just a concrete answer for me of what you could predict right now that might
I'll
surprise
give you
me.
one, which is a bit, which is it might actually be a bit self-serving, and it won't surprise you. So what we have found with biological age, which is the thing that we can predict, which is basically your probability of future disease, but put as an age, is that it's this beautiful thing where it so cuts through everything in the people's head. Like if you're 35 and you get back your biological age and it's 38, you immediately know what that means.
Yeah.
You
Yeah.
immediately it immediately motivates you, right? And so what we have found is like their biological age being the main one is like predicting the future is very easily handed to a person and they can very quickly understand what to do with it. And so this idea of if you were to think like, oh, well, that's great, all this magic can happen, but how are people going to harness it? We already see that with our API, like getting people blood test results, but then their biological age next to it already immediately motivates them. If you couple that with, some guidance of what they might want to try to be healthier,
Yeah.
finally they're motivated to actually try that thing, right? And so
Yeah.
that's kind of the the cool thing is all this magic will, with us and other players really focused on it, like we'll be able to distribute it. People will want to use it. They'll know how to use it. It'll be quick. So
Yeah, I think the idea of bringing biological age into that conversation is so grounding, really, because a lot of times, you get your blood test results. It doesn't make any sense to somebody, even with a scientific background. Sometimes you look at it and you're like, what does this mean? But then if you just had a big number at the top, says you're testing like you're 45 and you're 35, you're like,
yeah,
I need to make some changes. So I think that I'm glad that you guys have packaged it in a way that just makes it simple, makes it easy for people to understand, and then that's
yeah.
getting into the
And
conversation more.
thanks, exactly, and thanks to our partners for understanding that it would be so, right? Our partners kind of like, one, it's like, oh yes, this is great. We'll get more market share because people generally, like these sort of things. But the idea to give it for free, or give it for a very low price, include it in the blood testing,
Yeah.
that's a real credit to our partners for like understanding like, hey, our mission as a big blood testing company is to help people know how healthy they are, and this will allow them to do that. It will motivate them, and they've been quite happy to do it. um, yeah, I think as we move forward, that sort of thing is really the distribution path for a lot of this stuff, right? Is don't wait till people are looking for something. Just give them the information that they can then run with. Uh,
Yeah.
you know, so
If we nail prediction the way you're describing, so if the life model works, what do you anticipate healthcare will look like in, I don't even want to say 10 years from now, because the way LLMs and everything is moving so quickly now, it could be, what could healthcare look like in 2 years from now if the life model works?
so I'll make this a short example, but just to give you like a human example. So I actually had a spinal surgery 4 weeks ago now. Um, Basically, my left foot wouldn't be functional now if I hadn't had ChatGPT. Like I
Okay.
would have been in a lot of trouble. It basically, so I started having numbness on the top of my foot, my left foot. I was able to go into ChatGPT. I told a few people about it, and I talked to one doctor. Uh, and basically, it was like, oh, sciatica. Give it a few days. Do these light stretches. Don't push yourself. It's it's so it was like, okay, like kind of wait and see and do some things, right? I typed that into ChatGPT, and because I'm a little bit anal, but it also with good prompts, it could get you there too. I was like, it's numb, kind of near my big toe. Like I gave it a bit more. I wasn't just like my foot's kind of numb. I was like, it's numb near my big toe, and I also, which is a great prompt for people to use, like, what else would help you? What questions do you have for me, ChatGPT, that would help you like understand this better, right?
Sorry,
You went all fuzzy for a second.
yeah, I went all fuzzy and I'm not sure. Okay, I'm back.
There you go.
I
And
had
so
a call
the
coming in. That's what happens when you go live. So
it's really live, folks. You can tell.
it is
Uh,
really live. We're making the mistakes.
uh, and so basically, you know what it told me after I typed in, but this was all like surface level information that I could
Yeah.
describe. It was like, you probably have an impinged nerve at your L4, L5, and
Wow.
after an MRI and a bunch of doctors, had an impinged nerve at my L4, L5, right? But
I
because it
can't
was able to
believe
tell
it
me
knew
that.
exactly like the L4, L5, you know?
So this is a good example, right? This is a good example. Like it doesn't need to know all the interactions of the cells. You know why? Because even more than body pathways, nerves, like you can do like a 8-bit map of the big nerves in your body, right?
Yeah,
It's like
that's
this
true.
one goes over your shin and then goes to your big
Yeah.
toe, right? And so literally being able to describe like how my shin feels and how my big toe feels, it's easy for it to map it to like it's just is using all the context, right? And not even that much context was needed, right? And
Yeah.
this is kind of um, why it works better is because I think a lot of times that context is kind of ignored, but also because it's able to actually understand what's important, what's not important, ask me follow-up
Yeah.
questions that are important, not just general follow-up questions like that sort of stuff. But long story short, it sped up me going to not rushing into surgery, but getting surgery like maybe like 7 days later. What was basically happening is I had a fragment that was basically sawing at that nerve. So literally, if I had like had another week, I would have lost half more function in my left foot, and who
Oh.
knows how much would ever come back, right? And so that just gives you like a real world example of like this is the world we're going to is people are able to conversationally and the one thing I was missing, sorry, there was a point I was getting to there. The one thing I was missing is when I went to decide on surgery, that's where the model had to stop. It didn't know for me what were the results of doing that surgery because it didn't have that
Okay.
data. It
Yeah.
wasn't
Okay.
trained on person that looks like Mike. It wasn't able to imagine a world where exactly Mike had exactly the surgery and what would happen.
Yeah.
And so that's where we get into the time stamped and biological data of this is the measurements and the prediction of the current and future state of the body. This is the intervention. This is what's the body's gonna look like after that. Uh, and that's what the model is really going to be the back end for that we don't
Yeah.
have with the large language models today.
Yeah. That's truly such a remarkable story because I feel like we all are doing this on the side. You know, like all of us are typing things into ChatGPT and we're self-diagnosing. We're bringing our wearable data into the doctor, and doctors are getting frustrated with this, or some appreciate it. But combining it all into something that's, I would say, a bit more official, like this large biological model. I have all my data in there. It's something that's trusted. I think that's going to be a huge shift instead of just me being like, look, I walk 10,000 steps a day. Use that, but being able to really have some like a big lever to pull, I would say, with
Yeah.
that with the large biological model. That's going to be truly incredible. And then it's like, so then where does the doctor still fit in? You know, if the individual is able to diagnose, get the predictions, kind of make changes, do all this, like
Hmm.
when do we just go to the doctor then for the surgery, or do you see a future where there may be a more active player, or they take a different type of role in how we take care of our health?
Yeah. I think, I mean, you and I, like, we know how important human connection is. Um, we as humans need connection with other humans. It's a huge part of our lives. It's a huge part of our health. It's a huge part of our happiness. Um, and I think that will be the direction that doctors and nurses. A big part of what they do today is that already. To be honest, the good ones. Um, I think a bit of the problem today is that a bunch of them don't realize that's a big part of their job, but the
Yeah,
ones that do
yeah,
are amazing
yeah.
at it. Like I won't give too many details, but a friend was in the hospital and basically me visiting her and the head of that hospital came down, actually the hospital group came down and basically, yeah, he did an assessment. Yeah, it was great. And we appreciated his like doctor assessment, but he made that my friends feel so much better, and not because of that assessment. Actually,
Yeah,
ChatGPT kind of told us a bunch of the same stuff,
yeah,
but because he was so good with her and so like gave her like that human connection and that caring and
yeah.
really seeing her, right? And so I think that can do amazing things, and that's what doctors and nurses and will continue to do, and less of the decision making, more of that human connection.
Yeah. Yeah. I mean, that, like, the bedside manner or feeling comfortable with your doctor is so important and something that's missed a lot. And hopefully, with some freed up time, because AI can give doctors back a lot of the time for note taking or prediction or all of this, that maybe they'd be able to invest more into that connection and giving people a bit more time and a bit more care. And I would hope.
Exactly. Yeah, and I think uh, I think that's good to highlight. That is also like taking some of that off the person's plate allows them to, and I think you'll just have different uh, people that like different things or have different abilities will join the profession.
Yeah.
uh, it won't be the people that are amazingly good at a particular level of memorization
Yeah.
and kind
True.
of analytics. It will be a person who's maybe more empathetic. So I think we'll see a change in kind of the composition of people that join the profession as well.
I think that's a good 10-year vision of the future. I would really like to see that. We're
Hmm.
almost up on our hour, Mike. It went by so quick. So for our last couple of minutes, where can people find you? How can they download Humanity?
Hmm.
Who do you partner with as well? In case, I don't know,
Yeah.
maybe some people are out there that want to use use the Humanity API.
Yeah, for sure. Thank you. Yeah, so basically anybody that has health data on their customers, our big partners right now are blood testing companies because they, as we touched on, like it's immediate benefit. Person gets a blood test and then they also get their biological age along
Yeah.
with it by they're feeding that through our API, getting back the biological age, giving it to their customer. The big thing is two things. One is the person gets healthier because now they're motivated and they know how healthy they are. But the other thing for the business is that people they'll start testing more often because they get more out of it. They want to see their biological age again. They don't necessarily
Yeah.
want to see their cholesterol again, right?
Yeah.
And so the other one, as we're moving forward with life, so life is for everyone is the name of is the GPT. We're life. As we move forward with that, I think different people that want to join to help us train it, people that have data sets, a little bit further, but not too much further, than people that have models. So have some great friends, like have a female kind of health tech company that looks at like deciding on contraception best, what contraception is best, what HRT is best. They would be able to like then train their model on top of this foundation
Okay.
and get even stronger prediction power. And so people like that would want to train on top. Yeah, and you can find so it's humanity.health, And if anybody wants to reach out to me, I think we can probably put it in the notes or somewhere. But
yeah, we can put it.
mg@humanity.email. But
Perfect. Thank you so much, Mike, for such an interesting conversation today. Thanks for being back on the podcast and for doing the first live episode with me.
It was pleasure.
Super fun. Yeah.
It's good. It's good we inserted those things. It was really live.
Yeah, it really was live.